A background on Noah, for those that don't know who he is, don't know our story, Noah has 7 different heart defects. He was born with a hole in his heart and essentially needed a full repair of his heart to get it to function as one single pumping chamber. There were a lot of things going on with his heart when he was born, and so he needed to have all these repairs in order for it to function as normal as possible, by also taking a lot of the stress off of his heart as he was growing. Noah had to have his first surgery at around 10 days old, his second at 6 months old, and then his third at around 4.5. We've had some complications in the process of each surgery, but nothing major or life-threatening, but just exhausting to have to go through. Noah also has hetrotazy, where his stomach and his liver are flip-flopped. They're mirrored of each other. He has intestinal malrotation. He's a splenic, so he doesn't really have a functioning spleen, and Noah has autism, high functioning with ADHD and ADD. He's also mixed receptive and expressive language delays. So he's a very complex kiddo with a long history of medical conditions that will require a lot of videos to go over everything that he's got going on with him. He is 6 years old now, and he is thriving. He is very energetic, but he's also on medication for his ADHD to keep him calm. He's on aspirin to thin his blood to prevent him from having any issues with possible strokes and other issues that he needs to have the aspirin. He's also on amoxicillin for his spleen to prevent him from getting a blood infection, because we don't know how his spleen would handle a major infection. And he is in first grade. On January 30th of 2016, Noah was born. He was a good color, and I didn't really know, he didn't look like he was a cardiac baby, because he looked very healthy. Within 3 to 4 days, his oxygen started to drop, and he was needing oxygen right away. That's when I found out that he had more than just one heart defect. He has 7 and would need his full repair in order to live a long and healthy life. I was told about all of the surgeries that he would need over time, all of the risks, and also the possibilities of his future. And he had his first surgery on February 9th, 10th of 2016, where they did a pulmonary artery banding on his heart to help the flaps open and close when the blood flows through to his lungs. Noah developed a clot on his portal vein right after he had his surgery and had to see a blood doctor to follow up and monitor that clot for a period of 4 years. I had to do ultrasounds to make sure that the clot either stayed the same, got smaller, or wanting to make sure that it didn't get any bigger. And so he had to follow up every few months with the blood doctor. I forgot what they're called. And then over time, his appointments started getting spread out more and more as he got older, and was no longer at risk for what he could possibly have from having a clot on his portal vein. But that clot eventually went away, and so it was classified as a non-occlusive clot because it did not block his whole entire pulmonary artery. It blocked half of it, and because of that, it had a chance to get smaller and smaller and then completely disappear. So Noah was on a feeding tube for a couple of days after his surgery, but then gradually got better at eating and feeding and came home on just regular feeding, but had to have fortified feeds to increase his calorie intake. So then on August 30th of 2016, Noah had his second open heart surgery called the bilateral bidirectional Glenn procedure. And this is essentially taking the veins that are in the top part of his neck and rerouting the blood flow down. I'm going to put the information on the screen on exactly what it does, but it is to help the blood flow that's going upward, making it go downward and routing the flow so adequate amount of blood flow can get to the lungs. Right before Noah went in for the Glenn, he was hospitalized for 2 to 3 months prior to the Glenn because he had caught rhinovirus, which rhinovirus is a very severe cold for heart babies or for babies who have issues with their lungs and oxygen saturations. Babies with heart conditions are prone to getting rhinovirus as well as any upper respiratory infections, just because of how weak their hearts are, and how they struggle as it is with their oxygen and breathing. So he was hospitalized for 2 months on high flow oxygen, and so he was already on a feeding tube prior to his surgery and was on that feeding tube for a while because he wasn't really taking bottles by mouth. He really didn't have the energy to eat. And so after surgery, he came home on a feeding tube for a month and a half. He also went into what is called a tachycardia, which is essentially a really fast heart rate. And he had that right before his Glenn. I had showed up at the hospital and found out that he was in the ICU because his heart rate spiked, and so they had to put him on propranolol to lower his heart rate. And then as soon as he had the Glenn, his heart rate leveled out and he no longer needed the propranolol. But then we discovered that the reason he had a heart rate that was so high was because he also had a extra pathway that was in his heart that was causing problems with high heart rate. And he had to go on 24-hour Holter monitors throughout the last 3.5 years because of it. On August 11th of 2020, Noah had his final repair called the Fontan completion. This is the final repair for a single ventricle heart anatomy. The Fontan essentially allows the blood to pass through the lungs instead of passing through a ventricle or a ventricle. With the Fontan brings risks after post Fontan. Adult expectancy of a single ventricle patient with the Fontan circulation is up to 25 years of age, 30 max, I guess is what I've read. But at some point, the circulation can fail in a single ventricle patient, and then comes the talk of a heart transplant. patients can also have kidney and liver issues as well. But the main thing is that their heart can fail, and they can go into heart failure. And some have to have a fenestration done to their heart. But I don't have a whole lot of information right now that I can give on the heart Fontan, as I've mainly focused on the first two surgeries and the way that they operate. But I do know that the Fontan is not a cure for the issues of a single ventricle heart. It's all palliative care. It is all to give your child the best quality of life as they grow and develop. But depending on their heart and how their heart deals with the circulation as they grow, they can grow into adulthood with the Fontan. But at some point it is going to fail. It's never really promising on exactly when. So that is something that I always have to keep in the back of my mind, is that I know that at one point, it's not going to be a forever thing for him, that eventually he will need a heart transplant. But right now we just make memories, we educate, and just learn as much as we can about his congenital heart disease and focusing on making good memories.